What's up, y'all? It's Dr. Mia, your B3 specialist and board certified gynecologist at Mibella Wellness Center. And I am super excited for our weekly wellness with Dr. Mia. And I have the infamous Dr. Aryian Cooke, who is going to be joining us today. She is one of my super friends and actually one of my besties, my med school bestie. And we've just gone through this whole medical journey together. And so I'm really excited that she is here with us to talk about fibroids because everybody needs to know about fibroids. So go ahead, make sure you tell your friends to jump on because we're going to have this great conversation about fibroids, how to treat fibroids, how to prevent fibroids, how to stop them from growing. And I have the expert here with me. Dr. Aryian, could you please introduce yourself to the people? Tell them where you're from, where you live, tell them about your practice. Just give them a little info about you before we get this conversation started.
Well, good morning, everyone. First off, thank you, Dr. Mia, for having me. I am so honored to finally have made the cut. I've been eagerly awaiting my turn for this opportunity. So I feel really blessed to be here and to be your friend. My name is Dr. Aryian Cooke. I am a board certified OBGYN. I currently reside in Maryland. However, I am from Milwaukee, and that is where Mia and I met in medical school many years ago. I have a 13-year-old practice of my own. I started my practice 13 years ago here in Maryland. Also, Mia was a huge motivation and influence in me stepping out on my own and becoming a practice owner 13 years ago. We have now expanded into 3 locations in both Maryland and Virginia. So if you're in the DMV area, we are accepting new patients, plug. So we're happy to see you. I chose women's health because I felt that there was a need for providers to actually take the time to listen to women. And we pride ourselves on being the practice where women are heard. And I'm very happy to be here to discuss this topic of fibroids, which is a huge topic in my practice. I manage fibroids pretty much every day. And so I'm happy to be here to shed some light and answer any questions and just increase everyone's knowledge of fibroids.
Awesome. Thank you, Dr. A. First question. As far as fibroids go, I'm from Birmingham. I'm in Birmingham in Alabama. And so one of the things that I always teach my patients is that, about 80 to 90% of women have at least one fibroid. So we don't get excited about fibroids unless they cause us some problems. So let's just start off talking about some of the common symptoms that women experience with fibroids and when we should get concerned. So for me, I'll start. I know a lot of my women will come in and sometimes I'm just doing an exam and I notice that their uterus is a little bit larger than it should be, but they're not having any symptoms. They're not having any problems. I'm going to go ahead and get that ultrasound, kind of get an idea of what's going on with their uterus. But a lot of times it's because women come in and they're having heavy bleeding or they're having pain with intercourse or they're having irregular bleeding or they're having severe cramps with their cycles. So what are some of the most common symptoms that make you more concerned about a woman having fibroids?
Sure. Well, you did mention the most common symptoms that patients will report, but interestingly enough, there are a significant amount of women who don't have fibroids who don't have symptoms at all.
Yeah.
And this is where coming in for your preventive health screening every year is very important, because when your gynecologist does that pelvic exam and she puts her fingers in the vagina and then she presses on your belly, we're actually palpating or checking to see if you have fibroids. Fibroid symptoms depend upon where they're located in the uterus. The fibroids that are kind of hanging off the side of the uterus or on the outer layers, a lot of times patients don't have symptoms of necessarily bleeding, but they may report pelvic pressure or discomfort during sex, or when they jump up and down when they're exercising, they may be leaking urine. So those are some symptoms that are, will affect the patient's quality of life. And so, those are the symptoms that we take seriously and where we feel like we need to address their fibroids. Of course, more serious is anemia. Some patients will present to the office because their primary care doctor has diagnosed them with anemia, and they send them to the gynecologist after the patient reports, oh yeah, my periods are a little heavy. A lot of times women downplay a heavy cycle because that's just how it's been their entire life. But after a while, it's going to catch up to you and you're going to become anemic, and it will be caught either by you getting, you're getting your blood tested by your primary care or your gynecologist because of symptoms of fatigue, low capacity to work out. And so I have had patients who have come into the office, their blood count is so low that they're already to the point of receiving iron infusions or even have had a blood transfusion.
Yeah.
Those are the patients that go kind of to the top of my list of, investigating further and treatment of those fibroids.
Yes. So, again, this is Weekly Wellness with Dr. Mia. I have the infamous Dr. Aryian Cooke. I have her information in the chat, in the comments. So if you want to copy her address, her website address, you can. If you're in the DMV area, definitely. If you're having problems with fibroids, if you're having hormone problems, all these ladies down here are getting their pellets and feeling good and living this fabulous life. Dr. Aryian Cooke is your lady in the DMV area. She has 3 locations. So make sure you take down her information, go visit her. I'm real picky about who my patients see. So whenever my patients move from Birmingham, Alabama to the DMV, I tell them that their only option is Dr. Cooke at Waldorf Women's Care, because I know she takes care of all of her patients, regardless of race, regardless of socioeconomic status, regardless of all those things, the same way that I take care of my patients. So I'm comfortable sending them to her. So again, Weekly Wellness with Dr. Mia, we're talking about fibroids. Dr. Cooke just gave you some great information about symptoms and signs that are associated with fibroids. Some of the other things, when we're talking about heavy bleeding, it's heavy when you're messing up your clothes and you're missing work and you're having so much pain that you can't go to work. When you're lightheaded and dizzy during your cycle, when you can't do much of anything else during your cycle and your activities change because of your cycle. Those are reasons to seek out help. And again, we're going to talk about all the treatment options, and we're going to talk about the workup. So next, so Dr. Aryian, somebody comes to the office and their doctor sent them, they're having some heavy bleeding, they're tired all the time, they got an iron infusion, their iron is better, their blood count is better, and they still want children. They're 35 years old and they still want to have kids. They're concerned about these fibroids. What are some of our next steps, and what are some things that we can do when we're talking about fibroids and preserving fertility? Because that's very important. When somebody's 50 years old and having problems with fibroids, it's a different conversation from somebody 35 years old who wants to preserve fertility. So what are some of your next steps when a woman comes in with these symptoms?
Yeah, that's an excellent question, Dr. Mia. This is actually the most common group of women that I see. And it's also the most challenging group of women, that I treat, because, unfortunately, fibroids, I'm noticing in my practice, fibroids are affecting women at a much younger age. So I have even seen women 26 years old with extremely large fibroids. And sorry about that. And, obviously a 26-year-old, she has her whole life ahead of her. She wants to have children. She hasn't met the man of her dreams yet. And so they are wanting to maintain their fertility. Sorry, I just needed to turn my ringer off. Thought that was off. And so, the discussion first goes, what are your goals?
Right.
You can't always assume everybody wants children either. So what are your goals? Are your goals to, obviously decrease pain and bleeding? That's going to be an obvious goal, but are your goals to have children? If the goal is to have children, the next step is to determine, where the fibroids are, what's the complement of the fibroids, where are they located? And so we would normally order a pelvic ultrasound. Pelvic ultrasound will at least give us a rough idea about the number of fibroids and where they're located within the uterus, because where the fibroids are located in the uterus will determine our approaches.
Right.
So in a woman with smaller fibroids and her main issue is bleeding, sometimes we don't have to do anything for the fibroids. We educate them that they're there. We let them know that, how many they have, but also to educate them on the fact that the fibroids can grow and you can develop more, especially if you're 20 to 30 years old. The expectation is that, unfortunately, your fibroids will grow. You may develop more, but right now, they're small enough that we could just treat this symptomatically. So if the issue is bleeding, I am going to recommend a medication to decrease her bleeding. That could be hormonal or non-hormonal. There is a medication that is FDA approved for the treatment of heavy menstrual bleeding out called tranexamic acid. And it's something that you just take when you bleed, and it significantly decreases your flow. And then obviously there's hormonal options such as certain types of birth control. Progesterone only birth control in some studies have actually been shown to slow the growth of fibroids. So I'm a big proponent of intrauterine devices.
Me too. I was just gonna say that, but don't forget that IUD, baby.
The intrauterine devices are amazing. They are also FDA approved as a treatment for heavy menstrual bleeding, meaning studies have shown that there's a significant decrease of like 70 to 80% in your flow. And so if it is appropriate for you to have an intrauterine device, meaning, sometimes there's a fibroid in the cavity. And I'm going to touch on that just shortly. But if in best case scenario, you have small fibroids, you're not actively trying to get pregnant. So that's another, caveat. Obviously, if you're actively trying to get pregnant, typically I'll lean more towards like the tranexamic acid. But if you're not actively trying to get pregnant, I'm going to be suggesting an IUD. Just a basic birth control pill can also help. And there's a myth that birth control pills can cause enlargement of fibroids, and that is not actually true. And so birth control pills is also a good option. So those are the women who are not necessarily actively trying. We just want to diminish their bleeding. Unfortunately, though, there are some women, and a lot of women will present where the fibroids are already huge. So not only they're having heavy bleeding, their belly looks big because of the big fibroids, they have a lot of pressure. And sometimes the fibroid gets so enlarged, then at some point we have to talk about a surgical intervention. And that surgical intervention would be to try to preserve your uterus. And that procedure is called a myomectomy.
Awesome. Yeah, so definitely some great things. And I like the fact that we're talking about first the minimally invasive and really non-invasive. We're talking about medications. I want to add to that lifestyle changes. Now, y'all, I have actually seen women, when I tell them to do these lifestyle changes and they do them, come in and I have to go back and look at their chart because I remember their uterus being bigger, but now it has shrunk down. So foods in your diet, your fresh fruits and vegetables, decreasing your pork and your beef, eating cleaner meat, avoiding soy, exercising, maintaining a healthy weight. All of those things are ways that you can decrease the chance of your fibroids continuing to grow. You may not get rid of the ones that you have, but you can decrease the growth and you can decrease the progression of fibroid disease by changing your diet. So let's not forget about the wellness component too. I'm always talking about weight management. And at the end of the day, obesity, being overweight negatively affects so many chronic diseases, including fibroids. And that's another reason why I think we're seeing fibroids so much in our younger patients, because I never used to see fibroids where they're 20 weeks or, like a 20-week pregnant woman in a 25 or 26-year-old. I've seen that a lot. And so the first thing I tell them, let's fix this, but let's also make some major lifestyle changes, because those lifestyle changes are going to prevent further progression. Because even if we take the fibroid out and you're continuing with the same lifestyle, you already obviously are genetically predisposed to having larger fibroids because you had them at 26 and your mama had them and your grandmama had them. Remember your family history is so important. Now in Alabama, you can't really go by the family history, because I get patients to say, well, hysterectomy is running my family, so we just all end up needing hysterectomies. I'm like,
hysterectomy is a disease. It runs
I'm like, so I guess that means y'all probably seeing the same doctor and they give y'all that option of a hysterectomy, because again, some people need hysterectomies and we'll talk about that in a second, but everybody doesn't. So trying those changes in your lifestyle, trying those medical treatments to control symptoms first, and then getting to the point where sometimes there's something that we need to do. So like Dr.
Well, yeah, let me just, not to interrupt, I wanted to just piggyback on the lifestyle changes. Beef and pork, that's very important, limiting that. But also excessive alcohol consumption has been shown to be related to fibroids. There's some smaller studies that look at vitamin D deficiency.
Oh yeah.
That can be linked to fibroids. And then you mentioned genetics. And let's talk about race, right?
Yeah.
So being a Black woman, one more thing that we're at a higher risk for.
Right.
The statistic is that we have an 80% lifetime risk of developing fibroids. Not all of them will be symptomatic where you wouldn't do anything about, but just developing a fibroid in your uterus, just being a Black woman, there's an 80% risk of that. And also, stress. There's been some association with increased fibroid development when folks have a very, stressful lifestyle. So what you're mentioning about, your diet, eating clean, exercising, keeping down the fat intake is extremely important in, managing fibroids, potentially even preventing fibroids, or at least preventing fibroids from growing or worsening.
Yeah. So all the important things. So we always want to make sure we focus on the wellness components, the things we can control. We can't control the genetics. So we can't control how big our fibroids are going to continue to grow, even with all the lifestyle changes. So like Dr. Aryian was just saying, one of the things we want to do is do an ultrasound and sometimes an MRI so we can figure out where the fibroids are located, because it's good news if the major fibroid is located in the cavity, because that means a minimally invasive procedure. So a lot of times what we do is in the office, we will do a hysteroscopy and biopsy where we look inside the uterus. And if we see polyps and fibroids, if it's a small polyp, we may be able to remove that right then. But most of the time what we're going to do is say, okay, we got this biopsy. We need to remove this fibroid. So then we're going to take you to an outpatient center or to the hospital, let you go to sleep so that we can use another procedure called a MyoSure, which you don't want to be awake having. And we remove the polyps and fibroids in the lining. To me, after this, if it's a woman who wants to preserve fertility, she's not ready to get pregnant, putting that IUD in or starting some hormonal birth control works really, really great. And then if they're in the muscle of the uterus, that's a different conversation. It's not the minimally invasive. So what do you do, Dr. Aryian, when you have that 32-year-old woman who's engaged, she wants to get pregnant in the next 2 or 3 years, she's got fibroids that are larger, so her uterus is not normal size, her uterus is more like 12 to 15 centimeter size. She's got some larger fibroids. She's experiencing the heavy bleeding. We've done the hysteroscopy. We've done the MyoSure. She's continuing to have the heavy bleeding. What are some steps that we should take because we know, one, she's going to want to get pregnant in the next couple years. 2, we know she obviously wants to preserve her fertility. But 3, we know we need to stop the madness. She's already doing the wellness stuff. So she's taking those lifestyle changes, making them a priority. So now what are our next steps with these fibroids?
So this patient has done all the things. So now she's referred to me. The next step for that for a patient in that situation would be a discussion about surgically removing those fibroids. And as Dr. Mia mentioned, because if the fibroid is not in the lining of the uterus where we can reach it vaginally, now the approach will be an abdominal surgery, and that which can also be done minimally invasively. So here at Waldorf Women's,
by some doctors, because my med school bestie does myomectomies through the robot. So she saves women recovery time, risk associated with fibroid surgery, because you got to remember that can cause scar tissue, especially when we do it open. But if you go to Waldorf Women's Care, it's a reasonable size. You're a good candidate. She can do the robotic myomectomy. Dr. Aryian, what is the difference in your patient? So I know you've operated on all these patients. You see the patient that you did the abdominal myomectomy on 10 years ago because you didn't have that option of the robotic myomectomy. Now you have the option of the robotic myomectomy, and you did this other patient 2 years ago with the robotic myomectomy, and now both of them need surgery again. What's usually the difference in what you see with that woman who had the open approach compared to the woman who had the robotic minimally invasive approach of an abdominal myomectomy?
Sure. Well, unfortunately, you're correct. A lot of women who've had fibroid surgery require some additional surgery later in life, depending on how young they were when we were trying to do the conservative, myomectomy surgery to preserve their uterus to have children. Now they're done having children, or they've had more fibroids develop and they're symptomatic. So that it is a real scenario that we're going to have to do surgery on a lot of these women again. Well, when Dr. Mia mentions open surgery, what she is referring to is a surgery similar to a C-section, where you have to make a bikini cut along the bikini line, and it's an open surgery where we're opening up the patient versus a robotic laparoscopic surgery. So most patients are familiar with laparoscopy. They may have had their gallbladder removed laparoscopically or appendix. A robot laparoscope is just a advanced instrument to perform a minimally invasive laparoscopic surgery. It just allows us to do those larger cases minimally invasively, typically through 3 or 4 8-millimeter incisions on your belly, on your abdomen. Whereas the open surgery, it's a cut, exactly a bikini line cut. Those patients that undergo robotic laparoscopic surgery are able to go home the same day. So it's outpatient surgery as opposed to an open case. They're in the hospital 1 to 2 days. Those patients that do robotic laparoscopic or laparoscopic surgery are able to drive their car again in about a week. My patients typically return to work in about 2 to 4 weeks, depending on how extensive, but definitely less than 4-week recovery time frame. Whereas an open myomectomy, unfortunately, those patients recovery time is closer to 6 weeks, 4 to 6 weeks, correct. And pain-wise, that's the big game changer as well, because most of the pain from surgery is really from large incisions. So if we're able to do the same surgery with 4 8-millimeter incisions, the pain level is a lot less. So I may have patients, I'll still send them home with adequate pain medication. However, those patients are requiring pain medicine, maybe the big guns like the Percocet or Vicodin for maybe the 3-4 days or less. Whereas open case, those patients may be requiring narcotic pain medicines for upwards of a week. And again, everybody's pain tolerance is a little different, but I'm just speaking in averages. So there's huge amount of data that is suggestive that that has concluded, I should say, that minimally invasive surgery is best for recovery, for pain management, and overall quality of life. And also in regards to scarring, so on those reoperations with open myomectomies, we are seeing that patients have bowel that is stuck to the top of the uterus, or their bladder is stuck. And so that makes it a more challenging surgery the next time. You have to now do what we call lysis of adhesions to separate, things that are stuck to the uterus so that we can operate in the pelvis again. I definitely have seen way less scarring, way less pelvic adhesions after robotic and laparoscopic surgery. So there's so much more benefit. And as Dr. Mia mentioned, not every GYN has the skill set to perform laparoscopic surgery. So if you're at a GYN office who does not perform laparoscopic or minimally invasive surgery, they're going to offer a laparotomy, not necessarily because you're not a candidate for robotic or laparoscopic surgeries, because that's not in their skill set. So never be afraid to seek a second opinion, especially at a center or an office where robotic and laparoscopic surgery is a big major part of their practice, because unfortunately everyone did not have that training, and it's okay. But it doesn't mean that you should have to undergo a more invasive surgery because your surgeon does not offer that as an alternative.
Yeah. So good. So that gives us a lot of information. Today, we're going to focus more on preserving fertility. We're not going to talk as much about the hysterectomies, but we'll do a part 2 because it's so much to cover when you're talking about fibroids. And I would love to have one of my besties on here again talking to me and educating the people. But I want to kind of go back and end it this way, Dr. Aryian. So not only do you perform surgeries, not only do you know what your patients experience, you yourself have had some issues with fibroids in the past. Do you mind sharing your story and kind of how that happened and how everything worked out so well for you with robotic surgery?
Sure, absolutely. I was one of those women who actually did not have symptoms from fibroids. I'd been diagnosed with fibroids during my pregnancy, but they were very small, and I never really had heavy menstrual cycles because I kept an IUD. All right, I kept it.
After my sweet godson August.
Yes, after that baby came out, that IUD went in and it never came back out.
Right.
So anyways, the IUD I had was a progesterone containing IUD, which, as I mentioned earlier, can decrease your flow. So I never really had cycles. If I did have cycles, it was very small. It wasn't until during a pelvic exam, my provider mentioned, oh, your uterus feels enlarged, and being a gynecologist, I just kind of, oh yeah, I knew I had fibroids. Never got an ultrasound. I do not recommend this. This is what you should not do. But what actually got me concerned was because I work out a lot and I wasn't able to hold my bladder. I would start leaking urine. I would feel pressure during sex. Certain positions were extremely uncomfortable. And then I myself I would press on my belly, my abdomen, and I could feel the masses in my belly. So,
and she works out all the time, so she was not having the pudge in the belly.
I was not having the pudge. No, ma'am, I was not. So I ended up having my sonographer. We do in-office sonography at Waldorf Women's Care as well. So I had my sonographer pop me up on the table, and she was just amazed. This is a 20-year veteran sonographer, and she's like, Dr. Cooke, how are you walking around with all these fibroids? So I had about 5 fibroids that were all about the sizes of oranges. And so I really did look like I was about 3 months pregnant. And because I had already completed my family and I was in my, mid 40s, I did opt for a hysterectomy. And because, a myomectomy for that amount of fibroids for someone who doesn't necessarily want to maintain their fertility is really, excessive.
Yeah.
And so my choice in the matter was to have a hysterectomy, which was, I found a colleague that I knew was very skilled and experienced in robotic laparoscopic surgery. And I underwent that surgery. I went home the same day. I don't feel like I have a very high pain tolerance, but I still did not require narcotic pain meds beyond like 48 hours. I did continue to take 800 milligrams of ibuprofen for a week or two afterwards. As a private business owner, I did go back to work at 3 weeks. I was actually doing minimally invasive surgeries part-time at 3 weeks. And then by 4 weeks post-op, I was full-time. I was working full-time again. So the minimally invasive surgery is a great choice, especially when you need to get back to work. However, you do need to take some time to recover because mostly you're just exhausted. You just need to take a nap in the middle of the day. And I tell my patients, I will not send you back to work under any circumstances before 2 full weeks. Because during that time you are very exhausted. I tell them like this: you don't want to deal with anybody's bosses or coworkers during those 2 weeks. You want to just be able to rest because rest is important for the recovery of your body. So, yeah, and that was my experience. I am happy I had it. Sex was better. I didn't leak. I thought I needed bladder surgery. Like it was really bad, as much the amount of leaking I had. So everything improved, and I thought it was the best decision for me. And I definitely counsel my patients on all of their decisions. And I guess my last comment about this is that make sure you ask all the questions and don't be afraid to get a second opinion if it doesn't sound right to you.
Right, because if your doctor gets offended by you getting a second opinion, it's something shady going on. Because me nor Aryian are ever offended when our patients want to go get a second opinion, because we know that we are giving you the best options. We're giving you all of your options, and we're educating you appropriately. So if you want to go and seek a second opinion, I think that's totally fair. And the last thing I'm going to say is, and that's the reason why we don't like to do myomectomies on women who don't want to preserve fertility. We prefer to do a hysterectomy because, like Dr. Aryian talked about, the scar tissue and then having to reoperate and the increased risk associated with that. Though we give our patients the option, if they're 50 years old, don't want children, and they just want to hold on to their uterus and they want the myomectomy, we may even, look at that option for them. But what we recommend, what were you going to say, Dr. Aryian?
I'm sorry, because I know we're running out of time, but I did want to mention the assessor. Do I have a second to mention that?
Yes, go ahead and mention the assessor for women who want to preserve fertility, don't want to preserve fertility, but want a minimally invasive surgery where they can go back to work in a week.
Correct. So at Waldorf Women's Care, myself and my associate doctor, Dr. Davenport, are both certified in performing a minimally invasive laparoscopic surgery called the ACESSA, ACESSA. That procedure is done under general anesthesia. It is outpatient surgery. And essentially, we insert a tiny camera, 5 millimeter camera in your belly button. And then we insert a little, like a skinny little rod into your abdomen. And we identify all your fibroids through ultrasound at the same time. And we insert the little probe into the uterus, and it has these little prongs, and it delivers energy, radio frequency energy to the fibroid, causing those fibroids to basically die. It's called necrosis, and the fibroid gets very soft and mushy, and then the volume of the fibroid decreases. So a lot of patients who have a problem with heavy bleeding or bulk symptoms like pressure will get relief. I just recently started doing this procedure. I've done several, and I have been amazed at patients coming in after their 1 week appointment, their post-op appointment, saying, "Oh, Dr. Cooke, that pressure I felt on my right side, it's gone already." I had heard that, I read about it, and I believed in it. That's why I got trained on it. But I was still a little skeptical that folks would get relief that quickly. But sure enough, each patient that has come in, they immediately, I had a patient just last week. She got her first period post-ACESSA, and she's like, it's already about 50% lighter.
Right.
So it really does help. And again, like Dr. Mia mentioned, this procedure right now, there is a warning in women who want to have children that, we have to educate you that there's not a lot of studies about the safety in women who want to become pregnant. However, it definitely is fair game for women who are done having children, but they don't necessarily want a hysterectomy or a myomectomy. The recovery is a lot faster. These women are going back to work in like a week. 4 to 7 days, very minimum narcotic use, which is very, huge. And so the ACESSA is also a procedure that we offer here at Waldorf Women's Care.
Yes, that's awesome. Yeah, I have had some patients to have some really good outcomes, and I've really saved some women from having any kind of major surgery, and it can get them to, menopause if they don't want children. And, our studies have shown that women have had children after the ACESSA. We just don't know enough about it to say for sure that it's not going to cause a problem, but we know that women have had healthy pregnancies after the ACESSA without
Very important point. Very important point.
So thank y'all for joining. I hope that somebody learned something. I want y'all to share this with your friends. People need to know that there are several options out there, that just because you have fibroids doesn't mean you can't have children. So don't let your doctor talk you into having a hysterectomy before you're sure you don't want future fertility. If you want to get pregnant and you have fibroids, seek out a doctor who will work with you and make sure that you can live your dream, have your babies in spite of fibroids, and still preserve your fertility with their treatment options. So it's Dr. Mia at Mibella Wellness Center. I look forward to seeing y'all. I did my whole month of May because it was Mother's Day month, and I want to make sure we focus on women's health and women's wellness. I want to thank one of my besties, Dr. Aryian Cooke at Waldorf Women's Care, for joining us and sharing all this information. But we will be doing a part 2 because I know people want to know so much about fibroids. So I'm thinking what we'll do is do a webinar during the summer where we can just talk freely, have a little bit of time to go over everything, and even talk about fibroids after fertility and how to treat them, the options for hysterectomies, and still we're going to always focus on their wellness. So Aryian, I'm going to let you take everybody out, remind them where they can find you, how they can follow you on Facebook or your social media. And I already put your information up that I'm going to share again to find you on your website.
Wonderful. Well, again, thank you, Dr. Mia, for having me. I think this has been a wonderful discussion. I can be found at WWC Gynecology or WaldorfWomen'sCare.com on Instagram. Don't look at Instagram, on Facebook and on LinkedIn. We're still working on the social media. This is actually my first Facebook Live. So this has been quite a treat. We are located in Waldorf, Maryland. Brandywine, Maryland, and Arlington, Virginia. We are accepting new patients. We are a practice of all women of color, and but however, we are open to seeing all patients of all races and nationalities, ages, and we have been in this community for about I've been in this community for 17 years. Wild Earth Women's Care's existence for 13 years. I love the DMV. I love the patients, and we're happy to see you all.
All right, so y'all got options up in the DMV area, y'all. So go live well, age well, and experience everlasting intimacy. Share this great information, and y'all have a fabulous Saturday and a great weekend, a great holiday weekend. Happy Memorial Day.
Yes,
Bye.
absolutely.
We'll see y'all next time. Look out for our next one.